Welcome to Global Nurses. This is a sample practice test on CBT. Mark your test against answers provided towards end of this video. Good luck. 1. What is the target oxygen saturation of a patient with respiratory disease who is known to retain carbon dioxide? A. 84-88. B. 88-92. 2. Where does the tip of a percutaneous inserted central catheter PICC line sit? A. Pulmonary vein. B. Aorta. C. Superior vena cava. 3. What is the function of risk assessment tools used in nursing practice? They A. Replace nurses' clinical assessment. B. Ensure all patients receive the same standard care. C. Supplement the nurse's clinical assessment. 4. What does CBT stand for? A. Change briefing therapy. B. Cognitive behavioral tasks. C. Cognitive behavioral therapy. 5. What is the response of parents that confirms that the health education message regarding dehydration has been effective? A. The parents restrict fluid intake when the child has diarrhea. B. The parents state they will observe the child for darkening urine and an increasing respiratory rate. 6. Spirometry is used to help with the diagnosis of which condition? A. Chronic obstructive pulmonary disease. B. Diabetes. C. Cardiovascular disease. 7. What is the main aim of partnership collaboration? A. Positive staff experience. B. Positive patient event. C. Positive patient experience. 8. What is a protected characteristic? A. A characteristic that protects ways of working. B. A characteristic that protects equality. C. A characteristic that protects the nurse. 9. Which of the following is not a cause of sepsis? A. Urine infection. B. Perforated bowel. C. Traumatic brain injury. 10. A patient on a ward tells a nurse they are challenged by their limited mobility and feel like giving up. How does the nurse respond? A. Place them near the day room. B. Offer to discuss this. C. Find them a chair. 11. An adult patient and their family member ask if a nurse can show them how to change a dressing on a basic wound. Once the patient goes home, what action does the nurse take? A. Explain dressings and wound care are too complicated for them to understand. B. Tell them a nurse will visit and change the dressing for them. C. Show them how to change the simple dressing if needed. 12. A patient has heart failure and asks questions that a nurse isn't sure about. What actions does the nurse take? A. Explain it is not within their field of expertise, and they cannot answer the question. B. Refer the patient to the heart failure specialist, nurse who will answer the questions and provide support when the patient goes home. 13. From the following professionals who is able to remove sutures? A. Only those who have been shown how and are proficient. B. Medical staff only. C. Only registered professional. 14. What is evidence-based practice and why is it important in nursing? A. It enables nursing staff to evaluate research so that they can choose their preferred test or treatments and discuss with their patients. B. Enables nursing staff to evaluate research to understand the risks or effectiveness of diagnostic tests or treatments. 15. A nurse suspects a patient may have a urinary tract infection. Which indicator is relevant to urine sample collection? A. Urine sample collection is a procedure required for all service users. B. Urine sample collection is a procedure to identify potential infections in the urinary tract. 16. A nurse is asked to explain a patient's current condition. They are unsure of the diagnosis. What action does the nurse take? A. Look up the condition on the internet and explain it to them. B. Tell them that the nurse is not qualified to say and ask them to find out from someone. C. Refer them to their consultant to make the explanation. 17. After commencing a blood transfusion, at what point does a nurse first check the patient's observations? A. 30 minutes. B. 15 minutes. C. 45 minutes. 18. What is the name of the research method that looks at both quantitative and qualitative data to inform practice? A. Double method. B. Mixed method. 19. Which position will reduce the effort of breathing for a patient who has breathing difficulties? A. High Fowler. B. Left lateral. C. Right lateral. 20. Registered nurses are expected to be a role model for others. What does this mean? A. Providing unconstructive feedback to others. B. Demonstrating positive behaviors and attitudes towards diversity. C. Demonstrating the ability to not admit to mistakes or to learn from mistakes.